EMEA webinar series, part of the Cynosure University event platform. This platform has been designed to provide the best industry support for practitioner success and house a library of educational resources that can be accessed at any time after this webinar. These resources contain valuable clinical information, best practices, marketing tips and tricks, product demonstrations, and more. Today, it's my great pleasure to introduce Dr. Maurice Adatto to share his formidable experience in how to treat pigment and vascular conditions with the MaxG handpiece from the Icon device. Dr. Adatto is the founder and medical director of the Skin Pulse Dermatology, Laser and Beauty Center in Geneva, Switzerland. Uses an extensive array of laser and energy-based devices in his practice and has many years of experience with the Icon platform technology. I'll hand over to him now, but I'd like to encourage any questions that you might want to ask. If you type these into the message box during the session, I will pose some of these to Dr. Adatto at the end of his presentation. For those that we might not be able to address directly during the webinar, we'll do our utmost to communicate back to you with his answers in the next couple of days. Over to you, Dr. Adatto.
Thank you, Donna. Hi, everybody. I think in this difficult time, it's good to keep updated on our knowledge. And during the next half an hour, I want to update you on the possibilities of the MaxG handpieces on the Icon platform, which I use since its beginning. So the agenda will be like this. I will discuss today only the MaxG handpiece, and I will discuss first vascular cases because this is my main point of interest with this handpiece, and then pigment cases as well. So let's start with vascular. I'm sorry to bother you with some basic physics, but it's very important that we spend a few minutes on that at the beginning, so you will understand much better later on the characteristic of this MaxG handpiece. This is an absorption curve of oxy and deoxyhemoglobin. And with vascular lesion, there is a trick and something very particular. Here we have the absorption curve for oxy and deoxyhemoglobin of a small red vessel located superficially. So to our eyes, it looks red. And you can see on this graph that the absorption curve of hemoglobin is located within the visible wavelengths, the visible range around 560 to 580 nanometers. Okay, so this is for a small superficial red vessel. Now you take another vessel, but located deeper, and you take a vessel from a larger diameter, and you see that the absorption curve is completely different. Instead of having the peak, it was here in the visible range, we have the peak now in the mid-infrared range of wavelengths. So there is a switch towards the visible to the infrared. So this is very important to understand because this is one of the characteristics of the MaxG. So again, here, a small diameter vessel located superficially has a range in the a range of absorption in the visible wavelengths, while a larger vessel located deeper, there is a switch of the absorption in the infrared wavelengths. And the MaxG takes that into consideration, and I will explain to you in detail that. But you have to understand this switch of absorption depending on the size and the depth of the vessel. So the characteristic of the MaxG on the Icon platform It's really the newest generation of optimized pulse light, and I insist of this optimized optical pulse light for pigment and vascular treatment, because it's not a standard IPL. It has really main characteristics. So the MaxG, compared to the older generation, the LuxG N-piece, has more energy available across all pulse duration. It has a greater peak power, and this is one of its main characteristics, is to have great peak power at short pulse duration. This is crucial if you want to have good results with vascular lesions. And you have higher fluences to address mid to large size resistant vessel. So one of the main feature is these high peak powers at 3 and 5 milliseconds, which are very short pulse duration. And this is the work I did with the company at that time to match pulse dye laser for Port Wine stain. One of my main point of interest in vascular lesions is Port Wine stain. And we were working with the company to have something matching pulse dye laser. And this is one of the clinical trial we did comparing pulse dye laser with the MaxG. And people think that you need purpura to have good results. But as you can see here, the pulse dye laser already shows purpura at 7.5 joule at 3 milliseconds, while the MaxG only shows purpura at 26 to 30 joules at 3 milliseconds. So on this light Port Wine stain of the abdomen, we can see that treating with the MaxG at 10 milliseconds without purpura, we get very nice results. While if we have some purpura at 3 and 5 milliseconds, we get some PIH. So treating without purpura in some situations is also very convenient and can lead you to good results. So another characteristic of the MaxG is the improvement of the cooling. There is a constant cooling at 5 degrees, and it's a very sophisticated cooling, and I will come in details after to that. The second technology which is enhanced is the photon recycling technology, and finally the smooth pulse, and I will go into details about that. So first, the cooling system. It's a very sophisticated cooling system which goes through a sapphire tip, and sapphire tip is really something important because this is a crystal which has conductivity, which is the highest conductivity possible except diamond. But sapphire is the second material which has a high conductivity. So using sapphire for cooling is an evidence, but also sapphire is a much more expensive crystal than other crystals. But here the company decided to put the best they could to have really a very efficient cooling system, because if we work with high fluences and high peak powers, we need to protect the epidermis. So there is a circuit of cold water coming through the sapphire, and then when it's warm, it goes back into the internal cooling system. So this provides a very good safety and also less pain, because if the skin is really well cold, there is less pain for the patient. So a very efficient cooling system. Now, another interesting technology, it's this photon recycling. You know that there is a big percentage of photons which are lost due to scattering. So this is a patent technology, and instead of wasting the photons outside the handpiece, there is a system of photon recycling which reabsorbs the photon scattered, and then re-inject the photon into the tissue. So with that, you recycle about 50% of the photons, meaning that you need less fluence to have the same effect. So less fluence means also more safety and less pain. So this is a very interesting way of producing energy. And finally, the smooth pulse. This is also critical, because in some cheap systems, like here on the left, they tell you, okay, we produce a pulse of 20 milliseconds. But in fact, if you look at the details of the pulses, it's not one pulse of 20 milliseconds. It's many little pulses put together as a packet, which makes 20 milliseconds. But if you look at the detail of each pulse, then each pulse goes a little bit above the threshold of epidermal damage. This green line represents the threshold of epidermal damage. So these 4 pulses are not the same at all as this square internal smooth pulse. When the MaxG tells you you are working with 20 milliseconds, you are really working with 20 milliseconds, a square smooth pulse, and this is very important to preserve the epidermis. Let's come back to the very beginning, where I told you that there is a difference between a small vessel or a large vessel. The system knows when you will treat a small superficial vessel or a large deeper vessel. How? Just by selecting the pulse duration. If you select a pulse duration from 10 milliseconds or below, the system knows that you will need high peak power and that you are treating red superficial vessels. So the system will favorize and will shift the energy towards the visible wavelengths between 570 to 590, like here in our diagram of the beginning. If you select a longer pulse duration, 40, 60, 100 milliseconds, then the system knows that you are treating a deeper vessel of a larger diameter due to the selection of the pulse duration. Then the system will shift the emission towards the 900, 1000 nanometers to match these absorption curves that we have seen. So there is a shift by the system depending on the pulse duration that you are using. And this will increase the efficiency, of course, because it will target exactly the right size and diameter and depth of vessels. Another interesting point is this lack of emission between 700 and 850 nanometers. I call this graph the camelback, because you have 2 humps, one here, one there, and nothing here. And why nothing here? Because in fact, these wavelengths, they are not absorbed by hemoglobin in any condition. So why emitting at those wavelengths? It's useless. It would create heat for nothing and pain for nothing. So the company has decided that in between these wavelengths here, there will be almost no energy output, and this is a very wise decision. So I presented this paper together with David Friedman at the ASLMS annual conference in Florida in 2012, based on what I have said just before on a theory. We wanted to see the real clinical stuff. So there were 2 centers, mine in Geneva and Dr. Friedman in Jerusalem. 16 patients, 10 female, 6 male, 14 port wine stain with 2 capillary venous malformation. And we selected 2 types of different parameters. Dr. Friedman worked with one pass at 50 joules per centimeter square at 10 milliseconds, and I worked with two passes, 34 to 36 joules at 10 milliseconds, then immediately after a second pass with 22 to 28 joules at 5 milliseconds. And we look at clinical assessment, and I did some 3D measurements for objective evaluation of hemoglobin clearance. So these are the results of all the patients together, and you can see that there is already, after only one treatment, there are patients who show a very good answer. And globally, in about 2/3 of the patients, we observed at least 50% or above improvement after 1 to 4 treatments. And you can see, of course, that after 3 treatments, the results are very, very good. So these are some clinical results. This is a patient from Dr. Friedman. So clinically, he stated that the improvement was 80%, and that was 2 months after one treatment with his own parameters that I told you before. Another patient with a port wine stain on the right upper leg, and you can see about 70% improvement 3 months post retreatment with his parameters. This is one of my patients with a port wine stain on the neck and the cheek, and you can see the improvement which has been calculated by the Antera 3D device with 90% improvement, okay? And this area, I will come back on it just after, because there is a little trick that I will show you. So this result here on the right is 6 weeks after 4 treatments with my parameters with my 2 passes. A patient with a capillary venous malformation on the chest, you can see the improvement, about 80% improvement after 3 treatments. You can see the 3D images and the percentage of improvement. Another patient with a port wine stain on her right cheek, and you can see the various improvements depending on the number of sessions. This is improvement after first session. This is improvement after the second session, more than 50% improvement with my 2 passes parameters. Another patient here, about 50% improvement after 2 treatments with a port wine stain here on her left cheek. And another one on the, this is right cheek, not left cheek. This is a right cheek. And you can see about a little bit more than 40% improvement per 2 treatments. So in conclusion of this study, the OPL treatments were observed to be safe and highly effective for clearance of port wine stain and capillary malformation in adolescents and adults. We wanted at that time to do a pediatric study, but unfortunately we didn't find the time to do it. By the way, none of our patients in this study had severe side effects. We had no bullae, no crusting, no scarring, nothing. These are some of my private patients outside of the study treated with the MaxG. You can see here post 3 treatments the improvement. And here I used a tool to measure the index of erythema. So a normal skin has an index of 130. Before the treatment, the index of erythema on her cheek was 260. And you can see that after 3 treatments, I almost put back the index on her cheek back almost to normal. Same index on this patient with a port wine stain. And you can clearly see the improvement with the various index, and you can see the unchanged because of no treatment on the upper lid. This patient with a deeper malformation, and you can see that this switch of wavelengths towards the infrared is very useful here because we could treat this deeper bluisher malformation on his cheek. This is a case of a resistant port wine stain. The patient had many sessions with pulse dye laser, and you can see the improvement post-2 treatment with the MaxG. This is a difficult case. The pictures don't show very well, but he's a skin type 4 from Peru. Difficult location, difficult skin type to treat, and it's a variant of port wine stain called angioma serpiginosum. It's not very common. Difficult to treat because they are tiny vessels, and difficult because he's a skin type 4. So you can see the 2 months post 1 treatment and 1 month post 4 treatment on the chest, almost completely gone. This malformation was going along his arm and forearm. This is his arm, and you can see after 3 treatments, almost completely gone. And this is even more difficult because it's forearm, and of course it gets more sun than the chest. So we have to be very careful with that, and you can see that the improvement is really nice. I didn't do more than 2 treatments because the patient was very happy with the result. Poikiloderma is a classical indication. In male, it's more difficult than in female because the skin is thicker, and you can see the very nice improvement here after 3 treatments. And same patient on the other side, you can clearly appreciate the improvement. Another male patient, again 3 treatments, very nice improvement, not only on the color but also on the texture. And again here, he didn't want me to treat the Lentigo, which I could, but he wanted to keep his Lentigo as is, so I didn't treat it. Same condition, but now on a female patient, which is much more classical than on male. Very nice improvement also, and here too, very nice improvement. Again, between 3 to 4 treatments are needed at monthly intervals. A very classic indication, it's also this telangiectasia post-radiotherapy. So the patient had an ablation of the breast and then radiotherapy on top of it, and you can see the improvement on the telangiectasia. It's a very nice improvement. Remember my first patient with the port wine stain and the area, the preauricular area, which was not treated. I couldn't because she had a crease there, and so the contact, the cooling would have been difficult. But for this indication, there is a small spot adapter that you just clip on at the end of the MaxG, and this gives you a 4 millimeter spot. And allows you to treat the crease, and that's what I did here. We had 90% improvement, and I went with this adapter here in the crease, and then you can see it's treated completely and nicely, and I even could treat the ear itself, and you can see here I could go into this crease very finely, very nicely, and get also a very nice improvement. So in summary, I find that MaxG is a real improvement comparatively to the older generation for vascular management. Purpura, as I said, isn't mandatory to obtain satisfying clinical improvement. All the cases I did for the study didn't get purpura because with 10 milliseconds and 5 milliseconds, you don't get purpura at these fluences, but you still get very nice results, and patients really like not to have purpura. So for me now, MaxG is really a handpiece which is very useful to treat all sorts of vascular lesions. So let's move to superficial pigmented lesions. The main problem of pigmented lesions it's not handling the laser, because this is quite easy. It's making the real diagnosis. And this is very tricky. And if you are not a dermatologist and you see pigmented lesions, please be sure of the diagnosis. And if you are not sure, refer first the patient to a dermatologist colleague who might perform a biopsy to be sure, because pigmented lesions is very tricky. I have put here a few clinical cases. This young woman has this pigmented lesion on her face. What is it? Is it a cafe au lait macule? Is it a nevus? Is it a Becker's nevus? All those diagnoses are possible on her, and the issue, the result will not be the same depending on the diagnosis. This young woman had already 2 or 3 laser sessions in other centers with no results, and she came to see me to have another laser session. And I said, but why? What's the diagnosis? She said, I don't know. I don't know. So I performed a biopsy, and it's a form of scleroderma. It's a morphea. So hyperpigmentation in a morphea doesn't work with the laser. So she doesn't need a laser for that. This woman has a very special, very rare condition called nevus, blue nevus en plaque, which is described in the literature. There are very few cases. No one never tried a laser on that, because there is a risk of transformation in melanoma. So I didn't do it either. This is a case that should not be treated with laser. This gentleman here came to see me in emergency because he had a car accident. His face touched the airbag, and he has this post-inflammatory hyperpigmentation because her face rubbed against the airbag, and he wanted laser to remove that. And I just calmed him down, said, listen, you just need some sun protection, you just need a little bit of lightening cream and no laser. And he came to see me 3 months later, and everything was gone with no laser treatment. Well, this really looks ugly, but in fact it's completely benign. It's a seborrheic keratosis. And this looks more or less okay, but it's a melanoma. So be very, very careful with these pigmented lesions. They are very tricky, and the main thing is really to know the diagnosis first, and then to decide, is it reasonable to use a laser on these lesions. So this kind of Lantigo simplex, which fortunately we see quite often, you have the choice. They will work with many good technologies. You can easily use the MaxG for both of them. You can also use different lasers. You can use a Q-switch, you can use a Pico, but MaxG will work very well also on that. The mechanism with MaxG will be different than with Q-switch and Pico. I unfortunately don't have the time to go into details with that, but the clinical result will be also good using MaxG. Treating actinic bronzing is always tricky, and the main issue with that, especially on the chest, is to leave untreated areas, and then this looks completely ugly. So be very careful if you treat patients like this. First, you have to be careful with your fluences, not to put too high fluences. These lesions don't require high fluences, and I always perform two perpendicular passes to avoid untreated areas, because the worst that we can have is this kind of results where there are skipped areas and the result is really ugly. And then on top of that, after that, it's very, very difficult to recuperate those kind of situations. So better treat well, perform two passes at the right parameters, but be very careful, it's very tricky. One point that can help you in that is that you know that we have a melanin index, and unfortunately, the Fitzpatrick skin type doesn't really mean anything. If you take, for example, someone who has 30 or 35 melanin index, this person can be at skin type 3, a skin type 4, or even at skin type 5. So with our naked eye, it's very, very difficult to judge. Fortunately, on the MaxG and on the Icon platform, you have a tool called the SkinTel, and this is a live video. So it takes a few seconds. You just take 3 measurements consecutively, and then you press a button. This will send by Bluetooth the result of the melanin measurement, and this will give you pre-digested parameters of your MaxG with the reading of the melanin reader. So this is a real help for beginners to know when to what parameters to start, and especially the fluences and the pulse duration. This is a classical case of my patient with the MaxG, and you can see 1 month post 1 treatment, you already get a very nice improvement on this diffuse lentigos. And with that, I thank you very much for your attention. And as Donna said before, we can take questions by written, and I will answer to them orally. Thank you very much.
Thank you very much, Dr. Adatto. So we have had a few questions coming through. Now I know, obviously, without having had the in-depth training as a user to actually operate the device, it's difficult to discuss parameters for specific patients. But quite a few of the people watching have asked if you've got any potential guideline parameters for particularly the treatments when you were doing the port wine stains and the poikiloderma. Are you able to sort of give some idea of the sorts of millisecond and fluency settings that you might consider to approach with those? Obviously, it would be specific to each patient.
Yes, of course, and also specific to the skin type. I'm not going to treat my skin type 4 patient from Peru the same way that I'm going to treat skin type 2 patient with the port wine stain. Anyway, there are also many different ways to go to Rome. As you saw in the study we presented at ASLMS, David Friedman preferred to do 1 pass at higher fluences, while I prefer to do 2 passes with less high fluences. But both worked well, and none of our patients had any complications. So there are many ways to go to Rome. Personally, for port wine stain, I try to use either 10 milliseconds for the first pass, then 5 milliseconds for the second pass, with fluence ranging from 32, 36 joule for the first pass, then 20 to 24 joule for the second pass. This is roughly the idea to start with. And for poikiloderma on the neck, of course, I start lower because it's a neck, it's a more thin skin, it's a more reactive skin also. So I tend to stay with 10 milliseconds first pass, 5 milliseconds the second pass, but maybe around 26, 28 joule for the first pass and 18 to 20 joule for the second pass. This is roughly the parameters I use, but again, each patient is different, each skin is different, and you have to judge really carefully from patient to patient.
Absolutely, yes, thank you for that. And also, could you just give us an idea of how many of the interval that you would be using between your port wine stain treatments or your poikiloderma treatments in between individual sessions?
Poikiloderma is typically 1 month. I like to have monthly interval. Port wine stain, it depends a little bit. If it's a difficult port wine stain, I tend to leave 6 weeks instead of 1 month. With port wine stain, I like to see a little bit the result of the first session before doing the second, because if I see a good result, that's fine. If I don't see a good improvement after the first session, then I tend to modify my parameters, because port wine stain can be very tricky sometimes and need a modification of the parameters, usually going in shorter pulse duration. So for port wine stain, I tend to have longer intervals than for aesthetic conditions.
That's great. Thank you very much. Although you're obviously a very highly experienced user of the Icon, do you still use the SkinTel melanin reader?
Personally, I must admit that no, I don't. But I think it's a very useful tool for beginners. It gives a safety margin, and I encourage the beginners to use it. And by the way, we don't do only vascular lesions with the MaxG on the Icon. There is a big part of hair removal that my assistant do, because hair removal is delegated. And when they do hair removal, they have the obligation of taking a SkinTel before every single session. So we are sure that the patient doesn't get any tan in between treatments. And if there is a big change in the melanin index, we just don't treat the patient for hair removal. So for hair removal, it's really crucial. But again, it takes a few seconds, and I think it's useful to do it quite on a regular basis.
Absolutely. I mean, I think it's obvious that it's a great tool for ensuring safety with treatments, ensuring both the patients complied to what they need to do in between treatment sessions, but also to allow you to delegate to some of the other staff in your clinic. I think we have time for just one more question. Rosacea has been asked about. Do you have an idea of maybe how many treatments on average a patient might require, and do you find that they need to return for regular maintenance treatments for that condition?
Yeah, this is a very good question. I think for rosacea, which is a chronic disease, you have to tell the patients that unfortunately you are not going to cure the patient of the rosacea with the MaxG treatment. You will improve the redness and the cosmetic aspect, but you have to be clear from the beginning that it's not a final cure. So all my rosacea patients, I tell them that, and usually I start with a program of 3 treatments at monthly interval, and then I tell them you will need maintenance. And I would say half of my patients, they need 2 sessions a year, so 1 session every 6 months of maintenance. And the other half of my patients, they are happy with only 1 session per year. It very depends on how the rosacea evolves. And I tell the patients it's between 1 and 2 sessions per year of maintenance. And like this, they know that if it comes back, then they are not surprised. Otherwise, if you don't warn them that the rosacea, the redness will come back, they are disappointed. They come back and they say, listen, your treatment didn't work because my rosacea came back, which is absolutely normal. So we have to be clear at the first consultation to explain that we will improve them, but this improvement is temporary.
That's great. I'd like to extend my heartfelt thanks to you, Dr. Adatto, for taking the time out today to share this education on the Icon MaxG treatments. This webinar recording will be available online in the near future, and you will be kept informed of when and how you can access this. There's also more webinars scheduled over the next few weeks, so keep an eye out on social media and also your emails for information and links to register for these. And again, thank you for joining us, and enjoy the rest of your day. Thank you.
Thank you.